Greetings, everyone, and welcome to Season 2, Episode 2 of IVSA Kelantan podcast show. Today, we are glad to have Dr. Cecilia Leong with us to share about canine myofunctional therapy. Here's a brief background of Dr. Cecilia. Dr. Cecilia graduated from Nanyang Technological University in Singapore with a PhD in communication with a dissertation title of Information Communication Technology and Public Health Care in Singapore regarding policy and reality. In the year 2019, Dr. Cecilia obtained a diploma in canine myofunctional therapy from the National College of Traditional Medicine. Currently, Dr. Cecilia is the owner of Curative, which is located in Penang, Malaysia, that provides traditional form of clinical, remedial, and has sports massage components. We truly appreciate Doctor for joining our podcast show today. So, how are you doing today, Doctor?
I'm good. Nice to see all of you.
Good to hear that, Doctor. So now let's begin. We will start off with a light question, which is what makes Doctor interested in doing canine myofunctional therapy?
Okay. So I've always liked animals, and when I was a child, I had many pets from squirrel to ducks to small chickens, and of course there were the dogs and the cats. But one of the pets I had when I was an adult was a rabbit. I had two rabbits, and they were house rabbits, so they roam freely in the house. And one of them, when she was about 11 years old, she became very splayed. And in those days, there was not so much therapy around. So she really suffered for many years before she passed away, almost 3 years of being disabled. So when I heard about this course, I thought, oh, this is quite interesting, and it could have helped my pet at that time. So that's why I took the initiative to learn more about alternative therapies that doesn't involve drugs. It can elevate the suffering of our pets.
Thank you so much for your answer, Doctor. So the next question will come from June.
Okay.
Okay, that's very interesting. And let's move on to the second question, Doctor. So, for the second questions, was it challenging while taking the canine myofunctional therapy course, Doctor?
It was challenging in the sense that you really have to learn all about the muscles, the muscle groups in the body, and also how it attaches to the bones. So there was a lot of understanding of the dog's body, and there are like 700 muscles to learn about. So it was challenging in that sense. And then besides learning the where the muscles are located, you actually have to learn from what point it inserts onto the bone and what point it ends at which bone, so that when you do the therapy, you know where to start and where to end. So the stroke has always got to start from one end to another.
I see, Doctor. So I will pass on to JJ for the third question, Doctor.
Without further ado, let us dive into our topic today, which is canine myofunctional therapy. So, Doctor, would you mind explaining to us how canine myofunctional therapy actually helps the animal?
Okay. So before we even do the therapy, when I meet the patient for the first time, I will actually ask the owners about their home environment. What do they eat? Where do they sleep? And what sort of flooring is used in the house? So Asian houses or apartments, actually the flooring is not the best flooring for our pets, even for cats or dogs, because usually it's tiles. And I think most owners, they get the floor done before you get the pet, right? Because you bought the house, and the flooring is usually very nice and shiny and slippery. So the dogs, some of them actually, they are very healthy to begin with, but years of walking on slippery tiles is like you walking on a skating rink every day. So eventually something will go, like your backbone, your hips, or your knees. So it's important to understand where the dog lives even before you start the therapy, so that you can give suggestions on how to improve the home environment first. Because we can give a lot of relief through the therapy, but if the home environment doesn't change, then the dog still face the same challenges at home. The other thing we do is also to ask the owners how often do you walk your dog, and what sort of harness do you use? Do you use a collar or use a harness? And that way we can also understand what muscles are being strained. Because a dog walking with a collar has different strains than a dog walking with a harness. Because when you pull a collar, you're pulling the neck. Then when you pull the harness, you're pulling the chest or you're pulling the upper back. So we have to understand that first before we start. And then after all that, then we will ask the owner to show us how the dog walks. Um, and then we look at the walking gait, we look at the pacing gait, and we look at the running gait. So how the dog walks, whether it's a normal walk, is it bow-legged, is it cow hoof, or different types of gait. So we can actually see, even before we touch the dog, what possible muscles could be strained already. And finally, we do a palpation on the patient, and we'll feel the different muscles and see which parts are strained. And usually you can tell because some of the muscles that are strained are really like rock hard. And it's so painful that sometimes even the gentlest touch, the dog will be wincing. Right? It's painful. So that is just the start of it. So even before you start the therapy. So your question was, how does it actually help? So first of all, we give advice to the owners how to improve the home environment. That's part of the training, right? To understand how can we make their lives better before we even do the therapy. So once we start the therapy, the first thing is to get the dog to relax, to enjoy the session first. So when we do the therapy, we do the whole body. We don't just look at the part that is strained and we do that part. We always start with the part that is all right, because dogs are really anxious. They come to you and they're in pain and they're thinking, oh, is this going to be a torture session? Are there going to be needles? So you have to reassure them, you comfort them, and you praise them. And also you have to comfort the owner. The owner is also anxious. Is my dog going to be in great pain from this? So you have to tell the owner, this is a very comforting therapy. So after we start on the first areas that are not in pain, we slowly move on to the parts that are strained. And for the first session, is usually we have to make it a success session, right? The dog has to feel like, oh, this is a good thing I'm going through, and they want to look forward to the next one. So the first session is to ease it out slowly. We don't go all out to ease out the hard muscles. It's just like you going to a massage, like physiotherapists, right? If they went all out to do the painful part, you'll be screaming in pain and you'll be thinking, oh, I don't want to go back again, or let's stretch it further. So same thing for the dog, and even worse for them because they don't understand, right? They're thinking, why so much pain? So we ease it out, we make it very comforting, we ease out some of the harder parts, and when they go back, they'll feel a lot better. And I can say most of the time, the dogs actually understand after 2 or 3 sessions that this is something to look forward to, and it's something that helps me. So how does it help? Well, first of all, we have to see the injured part, right? The part that's strained, or they have hip dysplasia, or they have luxating patella. So those parts are not working at 100%, and it's very tight. And then after that, you have to understand where the compensation will occur. So you have a bad leg, then how does the dog compensate? The dog will compensate front limb, which side? Is it the other limb? So you also have to address that limb that is working extra hard to compensate for the injured part. So that's one way of helping the dog, like the whole body gets a good release from the pain. Secondly, it also increases nutrition to the muscle parts, because once the muscle has atrophied, then less blood circulation is happening, and you can see that it's not getting so much nutrients. So we also do deep tissue remedial massage on that part, and usually we do see good improvement within. It depends on how bad it is. If it's very slight, you can see within maybe 6 sessions, you can see an increase in muscle mass. But if it's really, really bad to begin with, and if the dog can't really walk, then sometimes we will bring it up to a certain level, but the dog needs to exercise in order to get back the muscle mass. Another way of helping dogs is the dogs with anxiety. So I have a patient coming to me that's um, in terms of muscle, how the muscle works and her muscles, there's nothing much wrong with her. She's actually quite good, but she gets seizures. She's highly strung. Like she's a very small dog, and she's also a teacup variety. So she's very highly, easily stressed. So the vet actually recommended to see me and to get her to relax, to decrease the anxiety, because that's what CMT can do also. It can promote relaxation, increase confidence in the body, and also increase all the endorphins that are released when you do a good deep tissue massage. There's also increase in interchange in proteins and the blood circulation. So another very interesting side effect of having it is that the skin and fur texture improves, and they also get very good appetite. So one funny thing was one of the owner said, since my dog came to you, my dog cannot stop eating, and now it's getting like put on weight, and then the fur is so nice. I said, yeah, that's one side effect of coming to me, because the dog is seeing me for a hip dysplasia, but the side effect is the fur improved and the dog has increased appetite. So she's quite happy about it, because before that the dog is quite choosy about food. So that's a good side effect. I mean, that's one of the effects of CMT. Yeah. So who needs to have CMT? That's one question to ask, right? Is it only for old dogs? No, it's not. It's actually, I have dogs. I have a German Shepherd who came to see me since she was 4 months old. So when the owners got her, when she was about one plus month old, they did not know it, but they had a dog that had very severe hip dysplasia. So they had to do an osteotomy when she was about 3 months, and after that she started seeing me. So she's still seeing me. So when she first started, because of the surgery, um, in Penang we don't really have a physio therapist. So I end up looking after her for very often, to give her relief and increase the muscle mass for the other leg, because she had hip dysplasia on both legs. But the owner was going to do, she just did the worst one, and she was hoping to delay the other one. So we work on the other one. So it's not just me doing the work, the owner has to do a lot of work too. So this owner was very conscientious. She really did her homework, and she brought the dog swimming. She did a lot of the home exercises. Um, so she's really doing very well today. She's coming to 2 years old, but she's still seeing me for maintenance. Not so often. So she started at twice a week, but now she has graduated to just once a month. So she just comes to me just to maintain it. Any other questions? Further questions from this? I do have something to add, but depends on your question.
I think that's all for my question, my part. So thank you. I will pass the next question to June.
Sure.
Fourth question will be coming from me. So,
Mhm.
doctor, how do you handle aggressive patients or patients that don't cooperate well during the canine myofunctional therapy session?
Okay. So luckily, so far, I have very few aggressive patients. There are some that are aggressive due to the pain. And if the owner can control the dog, then we can proceed. But if the dog is thrashing around, then unfortunately the session cannot proceed, because the dog cannot be thrashing around when I'm doing it. Otherwise, it defeats the whole purpose. We do use, very rarely, but we do use muzzle if the dog is prone to biting someone else other than the owner. But usually the dog is in a very calm state, so it's more to protect ourselves. Um, Other than that, very few of them are actually aggressive. Most of them look forward to their session. In fact, they actually know when they are arriving. So a lot of owners tell me once you make that turn near their arriving, they know already. And they're very eager. And I have dogs who are refuse to leave after that because they're already so relaxed, so they don't want to leave. And it's okay with a small dog, but I have another dog that comes to me and she is over 20 kg. So when she refused to leave, she really refused to leave. So those are good things, right? It's a good problem to have. It's a happy problem. So aggressive dogs, yes, there are one or two that have that sort of temperament. So for that, we will suggest maybe they need to consider other types of therapy, or sometimes when they have certain issues, maybe sometimes a nice walk, a calming walk can also help the dog. So we try to give alternative suggestions.
Thank you so much, Doctor, for answering the question. So the next question will come from June.
All right.
Okay. So, furthermore, Doctor, although you already shared a few interesting cases that you have encountered, but
Yeah.
can you share one more interesting cases that you have encountered with us?
Okay. So I think I will talk about Collie, who is in my picture. So Collie is a very young border collie. His name is Collie. Um, and his owner is very in tune with him. He has hip dysplasia, so it's a inherited disease for him. And he is so smart that when you ask him, Collie, are you in pain today? And he can answer yes or no. See, he choose yes or no. So he can answer you, right? He can even answer you left or right. So he's very, very smart. Um, so one day after, he comes to me quite often because he hasn't done surgery yet. So we're still trying to maintain him through CMT and laser and also acupuncture, which the vet does for him. So one day I had a very excited message from the owner. The owner sent me a video of him peeing, and she was so happy and so excited. She said, "Look, Collie is peeing." I said, "Huh? Yes, he's peeing." She said, "Yes, but he's peeing like a boy dog. He's not peeing like a girl dog anymore." So because of his issue, he has been peeing squatting because he can't lift the leg. But after coming for therapy and the owner is very conscientious, also walk him, so he can lift the leg and he can lift one leg and support himself with just the other leg, which was not possible for him before. So he's really quite an interesting case, and because he's very articulate in what he wants and what is the problem, he can tell you exactly like is today in which leg is in pain and then what he wants, and he will tell the owner, I want my heat pack today, you have forgotten to give me my heat pack, because having warm compress is one of the ways we have suggested at home for him to handle his pain.
Wow, that is so interesting about Collie. And I actually personally met Collie before, so I really have a deep impression about Collie, and I still
Yes,
remember him
you
now.
remember Polly, yeah?
Yep.
Yeah.
Okay, now I'll pass to JJ for the next question.
Okay.
So for the next question, I think now that people already know about the CMT,
Hmm.
so could you like briefly tell us the demand for this CMT in Malaysia?
Um, I think there's definitely a demand for it. There's always demand for non-drug intervention, because a lot of dogs, when they have, well, firstly, some owners prefer to try a non-drug intervention first, right? Because uh, these dogs are usually prescribed painkillers and they go on long-term management, and eventually you get some side effects too. So they do want to try some non-drug intervention. But the other thing that is also good is that it's always good to have a variety of weapons weapons to use in treating a dog, right? Or even a cat, because I also see cats. I have a few cats to see me. Um, so, for example, this cat that I see who is turning 25 this year, right? She's a very old cat. She has arthritis, but otherwise quite healthy. She's on painkillers once a month. She has a painkiller jab once a month, but CMT also helps to maintain her muscles. Of course, there's a lot of muscle atrophy because she's so old. So these are good options for owners to explore. I think definitely there is demand for it. Um, I'll be very happy to see more people taking up the course and being able to practice in every major city in Malaysia. Yeah, so I think there's definitely enough space in the pet care market to have more people like me. Yeah.
I see. Thank you, Doctor, for answering my question. So now, for the last question, I will pass it to Natalia. Okay.
Okay.
All right, Doctor. So, for our last question, what take home message would Doctor give to our listeners who are of vet students and even the public generally? And what are other things that Doctor would like to add before we end our session today?
Okay. So the first thing I would like to tell for the public, first of all, let's do the public first, is that if you're going to buy a pedigree pet, then please check the breeding pair, that the parents are healthy and the line is healthy. I mean, it's quite sad to see the young dogs coming with a lot of issues that you're supposed to have as an old dog, but they're very, very young. So there is actually, it's easily avoidable if you check the breeding pair, right? And don't buy, like, you see something cute in a pet shop and you just impulse buy. So that can be avoided. And also it's costly, right? If you have a pet that has issues from young, it's a high cost to maintain the pet, to give it that quality of life. If not, if you can't afford to give it that quality of life, the pet is also going to suffer. So that's one thing. And the other thing is, walk your dogs. Dogs need to be walked. They're not meant to be kept as toys. They're not toys, right? They are, even small dogs need to be walked. It's not just the big dogs. A dog that is 5 kilos also need to be walked. And walking, I think in Malaysia, when people say walking, half of them think that running around in the apartment is walking, right? But that's not true, right? Walking is putting on a leash and walking the dog outside and walking for a good number of minutes, not just 5 minutes, go out and pee and poop and then come back. That's not walking. So that, I think walking is really, really important. It's a culture that a lot of pet owners in Malaysia don't really have. Most dogs are kept in apartments or they're kept in the garden, and running around indoors or maybe outdoors in the garden is supposed to be good enough. But actually, you can improve their lives a lot if you walk them. So that's the take home message for owners. As for vet students, I think it'd be great if you as future vets have some physio rehab training too, right? So not just doing the operation and cut off the femur bone, the femur ball, cut it off and then send the dog home. Have some follow-up exercises that you can give owners, because not every area that you are working at will have a physio or rehab person. So the dogs are actually on their own after the surgery, and the owners are on their own. I mean, they can Google YouTube, yes, but it doesn't. It's not as effective as you showing them what they can do, exercises they can do, and I don't think it takes too much effort, because you already have the basics, right? You know how the dogs work, you know their bodies. So it's just one more step to learn more about the rehab techniques that you can teach your patients owners.
All right, so thank you so much, Dr. Cecilia, for your time today. And that is all for our second podcast episode for season 2. It truly was an interesting topic we had today as we got to know more about canine myofunctional therapy. To summarize today's session, canine myofunctional therapy is a massage technique that can help dogs with muscle and joint issues, and it is starting to get more demand and attention in Malaysia because of the awareness in society. So we truly hope that our listeners enjoy this podcast session. And once again, thank you so much, Dr. Cecilia Leong, for taking the time to talk about this topic with us today.
You're most
So
welcome.
thank you, Doctor. So
Nice
for
to meet
our
you.
listeners, thank you for tuning in to our podcast once again, and thank you for our team for making this podcast possible. Have a good day, everyone, and stay tuned for the next episode.
Can I